Hello, my name is Josie and I'll be your nurse this afternoon. Would you mind telling me your name, date of birth, and any allergies you have?
Elise Schilling, September 26, 2000, and lactose intolerant.
Okay. And then while I get some hand sanitizer on, would you mind telling me what year it is?
2020.
Okay, then do you know where you are?
SVSCP.
Perfect. Okay, so I'm doing a head to toe assessment, but first I'm going to go ahead and ask you a couple questions about your medical history. So, do you drink at all?
No.
Do you smoke at all?
No.
Are you on any medications currently?
Birth control.
Okay, and then do you take anything for your lactose intolerance, or do you just avoid milk?
Lactate sometimes.
Perfect. So then, let's see. Do you have you had any surgeries?
No.
Okay. And then I see that you have a tattoo. When did you get that?
Fall 2018.
And did that cause you any kind of irritation or problems at all?
No.
Okay, perfect. So I'm gonna go ahead and start. I would start with vitals. I cannot do blood pressure, temperature, or pulse ox with the tools I have, but I will do your pulse and respiration. So I'm gonna go ahead and start with that. Thank you. Okay, so your respirations were 16 and your pulse was 69. So then I'm going to go ahead and assess your head to start off with. Actually, I'm going to do your arms first. Take that back. Could you stick out your arms like this for me? Perfect. Wonderful. Could you squeeze my hands? Right hand squeeze, left hand squeeze. Wonderful. Skin is warm and dry. Please don't mind my cold hands. Muscle tone is symmetrical. Perfect. Arms down. Thank you. I'm going to go ahead and check for symmetry among the pulses. Radial is symmetrical. Brachial. Is symmetrical. Perfect. Could you give me some arm swings? I just got to check your range of motion. Awesome. Wonderful. Does that cause you any pain to do that?
No.
Okay. So then next, I'm going to now move on to your head. So I'm checking for alignment. It's nice and aligned with your body, no tilting. Your head shape is symmetrical, which is awesome. I'm going to go ahead and palpate your scalp and hair. So let me know if there's any tenderness when I do this. I don't see any redness or irritation. No lice, which is always good. And there was no tenderness?
Nope.
Perfect. I'm going to go ahead and I'm feeling for your sinuses now, okay? So let me know again if there's any pain or tenderness. Nope. Anything? Nope. All right, perfect. Then I'm going to assess your cranial nerves, okay? So this starts off with your olfactory nerve. Would you mind closing your eyes for me? And then I'm going to have you smell this scent and let me know what you smell.
Cinnamon.
Perfect. Wonderful. And then your second cranial nerve is your optic nerve. So usually I would check that with a Snellen chart, but as I don't have that, could I have you cover your right eye for me? And then how many fingers am I holding up?
2.
Perfect. Cover the other eye. How many fingers?
3.
Both eyes.
4.
Wonderful. So then your third olfactory nerve is your ocular motor. So I'm going to be checking that by checking your pupils. So could you look right at my nose? One more time on this side. Perfect. Pupils react well to light. They're equal. Okay, look right at the tip here. And then when I count down from 3, I'm going to have you change your focus to my finger back here, okay? Ready? 3, 2, 1. Perfect. Your eyes accommodated. That's what we like to see. So then for your fourth and sixth cranial nerves, so that's your abducens and your trochlear. I'm gonna go ahead and have you follow my finger, okay, without moving your head. Good. Perfect. Awesome. So then your fifth cranial nerve is your trigeminal. So I'm gonna go ahead and have you clench your jaw, and I'm just gonna feel. Wonderful. So then your seventh cranial nerve is your facial nerve. Would you mind raising your eyebrows? Smiling? Frowning? Good, good, good. That was so good. So good, thank you. Your eighth cranial nerve is your acoustic. So I'm going to go ahead and have you cover one ear. I'm going to whisper something in that ear, and then you're going to repeat it back to me, okay?
I do not have the coronavirus.
Perfect. Other ear.
Hi, my name is Alicia.
Awesome, okay. So then for your ninth and 10th cranial nerves, that's your glossopharyngeal and vagus nerve. And for that one, I'm just going to have you stick out your tongue. Perfect. Wonderful. You passed. Flying colors. Then for your 11th is your spinal accessory. So then I'm going to have you shrug. Okay, ready? 1, 2, 3, shrug. And back down. Perfect. Then for your 12th cranial nerve, that is your hypoglossal. So I'm going to get my tool here real quick. Handy dandy spoon. I'm going to have you open and then say ah, okay? Ah. Wonderful. I'm just going to set that over here. So now I'm going to be moving on to inspect your mouth. So your lips look nice and symmetrical. I see no cracking or anything, which means you're not dehydrated. Could you open your mouth for me? I'm looking at the soft palate, hard palate, tongue, teeth, gums. I don't see any irritation. Have you ever had any cavities?
Yeah.
Okay. Do you still have fillings?
Yeah.
Let me see again. Oh, okay, yep, I see it. All right. And how often do you go to the dentist?
Every 6 months.
Okay, awesome. I'm going to be looking at your eyes just one more time, noting any redness, which I don't see. I don't see any irritation of your eyelids or anything around there. Perfect. So next I'm going to go ahead and check your nose. So I'm just going to have you look up. Wonderful. I see no septum deviation. I see a little bit of mucus, but that's normal. I don't know any redness or irritation of the nares at all. Okay, good. Good. Next, I'm going to check the ears. So what I can see is that they're aligned equally on your head, which is good. I see that they're basically the same skin color as the rest of your body. And then I'm going to go ahead and palpate. I notice you have some piercings. Did those ever cause you any trouble?
No.
Okay. And then I don't have an otoscope, but I'm going to go ahead and still look in your ear by raising the pinna up and back. Okay, I don't see any redness or irritation. There's some earwax, but again, that's normal. It's what we like to see. So then next, I'm going to check your neck. So I'm going to have you look up, and I'm going to look at your trachea right here. Yep. Good. So it's aligned. I see that the skin is the same color as the rest of the body. No sign of breathing with accessory organ or accessory muscles. So that's all what we like to see. So next, I'm going to have you flip around. I know it's a little awkward on this bed. Perfect. So now I'm checking for your thyroid gland, which is kind of under where I just checked in the trachea. So I'm going to move that from side to side, which may be a little uncomfortable. So I'm not able to feel the thyroid gland, which is what we like to see. We don't want there to be any swelling or anything like that. I'm going to move your head. I'm checking the alignment of your neck and spine. Nice and straight. Good. Skin warm and dry. Perfect. So now I'm going to be percussing For lung sounds, I'm going to be tapping a little bit. I don't want to hear any dullness because that could be a tumor or excess air, so that could mean like emphysema or something we don't want to see. And I'm going to go ahead and lift your shirt if that's okay. Okay, so I didn't hear any dullness, which is a good sign. So now I'm going to auscultate. So listen to your lung sounds. If you could take a deep breath for me, in and out. And again. And again. Again. Good. Let's just move this down a little bit, right? And again. Okay, and again. So lung sounds are clear, which is awesome. That's what we like to see. So now I'm going to have you flip back around for me, please. And I'm going to listen to your carotid artery, which is right here. And I'm listening for any bruise, which would be like a whooshing sound. No bruise on that side.